University of Florida College of Medicine, Jacksonville has a new dean. Man standing right beside me, Leon Haley, joins the team at UF Health Jacksonville from Atlanta. A new inpatient hospital is expected to open in the middle of the year. Also big changes on the horizon. Leon Haley, welcome. Good to have you here.
Good to be here. Thanks for inviting me.
The medical landscape is changing with people not knowing what's going to happen with the Affordable Care Act, the ACA, with insurance issues and what have you. What do you see as the biggest challenges ahead for UF Health?
Well, one of our big challenges is the unknown, as you mentioned. So, new president takes the office January 20th. We've talked a lot about repealing the Affordable Care Act, and there's a lot of unknown. So there are about 20 million people that have gained insurance over the last several years from this act. We don't know if they're going to be insured. So if they're insured or uninsured, we're going to have a challenge of taking care of them at all of our institutions, but certainly at UF Jacksonville, because part of our mission is to take care of the patients who are uninsured and vulnerable, and so that's going to be a big challenge for us.
And this is a growing community. That provides another challenge in itself.
Anytime you have a growing community, that's good. That's a good thing for the entire community. That's a good thing for the health system, good thing for the business industry. But you also have to take care of patients. And so our faculty are very committed to, providing excellent care, training the next generation of educators, and doing research. But it will be a challenge to manage that population. Now,
there are a lot of similarities between Atlanta, from where you came, and Jacksonville. What do you see that you can bring with you to the River City?
Well, hopefully my 23-plus years of experience in an administrative role, ran the emergency department at Grady Memorial Hospital for about 17 in the dean's office. And I'd like to bring my commitment to, our four-part mission. So we talk a lot about delivering excellent clinical care, which our faculty do, educating about 40% of our faculty, 40% of our residents at UF Jacksonville stay in this area to provide care. We want to do groundbreaking and innovative research. And then the fourth part is really being committed to our community. And in the end, taking care of the patients that we serve and our population is really key for us. So I hope to bring my skill sets to that area.
Now, I know you've only been here a few days, but when you talk to the doctors and the nurses that really are the UF Health community, what are they saying to you about changes they'd like to see?
Well, they know that we're getting ready to open a new campus, as you described earlier, up north. And so they really want to make that work well. They want it to have, obviously, the same quality we have at our main campus, again, sort of providing excellent patient care. But they want us to continue to do that. They recognize the challenges that we have, so they're asking around, the challenges of the economics, as we described earlier. So, but they're committed to our patients, committed to our community, committed to providing that care for all of our citizens.
And how about when patients approach you, and I'm sure you saw this in Atlanta, and they say, the realities are I feel like I'm part of a quota system, but there are times I need to talk to the doctor. I need to find out information. I need to make sure that doc and the nurses have a good bedside manner.
Yeah, and they're talking about that, but patients are challenged because of access issues, and so we're trying to explore different ways for our physicians to have that better patient care contact. As you know, we have a number of clinics in several counties, and actually in 2 states, and so we're trying to make that doctor-patient relationship great. We're looking at things like telemedicine to try and increase that contact, and we're asking patients to be on the internet and work with MyChart, which is a way for them to access their information. So we're trying to create different ways in our digital environment for our patients to have access to our faculty.
Harnessing technology to make the whole patient experience that much better.
Absolutely.
Well, welcome to Jacksonville, and appreciate you being here.
My pleasure.
If you'd like to revisit this interview and learn more about this gentleman's vision for UF Health, go to newsforjax.com. After about 10:30, 11 o'clock this morning, it'll be posted on the morning show page. So, Rich, I know